Hi, I'm Dr. Julie Steinauer. Today I want to talk to you about maintenance after your vision therapy program is over. Now, before we get into talking about that, I do want to tell you how you can connect with us. If you're local, give us a call at 618-288-1489. If you're not local, you can go to our website at visionforlifeworks.com and do one of two things. Either click on the questionnaire button and fill some things out for us. You're going to get a response back, which is going to tell you a little bit about your vision. Or you can click on the schedule a consultation button and schedule a time to talk with me directly. Now let's go back and talk about what happens after your vision therapy program is over. Do you do maintenance, or are you just done forever and ever? Well, years ago when I first started doing this as a doctor, which was longer than I want to actually think about, it's so hard to believe. It's been like 21 years ago. Oh my gosh. But anyway, I digress. I didn't really think about, and most doctors did not actually prescribe that you continue to do therapy when you were all finished with your vision therapy program. I totally do that different now. And most other doctors do as well. In fact, if they don't tell you to continue to do some of the activities after your therapy program is over, might be a little cause for a concern. Here's why. If you've gotten braces, after the braces come off, you wear a retainer. This is kind of helping to keep the alignment of your teeth. After all, you still do things like chew your gum, you talk all the time, you make facial expressions like smiling and frowning. Okay, so you do all kinds of things that put stress on your teeth. The same way, or similar thing to think about, is that with vision, after vision therapy, you still use your eyes. You move them around. You have to converge and cross your eyes. You have to focus and align things with your eyes. You look at a computer screen. You look at your phone. You read a book. You're doing all kinds of things that are taxing to your visual system in a manner that's similar to the taxation that occurs on your teeth after your braces come off. So yeah, you should continue to do maintenance activities. In fact, we provide you with all kinds of tools and equipment to utilize after our services are completely over, and we give you a list of things to work on and how long to do them for and how often per month we want you to work on them, because we want you to retain the visual skills that you learned and maintain the vision that you left with, or even gain better vision than what you ended up leaving the program with. That's possible too. Some people will leave and finish the program, and what I mean by that is finish the program, not leave, but finish the program, and then they're like, can I continue to still work on my vision? What if I want to reduce my myopia even more? What if I want my eyesight to get even more clear because of the optic atrophy, the nystagmus, or whatever? Yes, you can continue to work on your vision. You don't have to just stop when the program's over. Particularly, this is very important for patients who've had traumatic brain injuries. So something like a stroke where they've lost vision, or they've suffered from maybe like a peripheral visual field loss. Continue to work on your vision. You can continue to gain more visual function back and more vision. It takes time. So yes, maintenance is super important, and we recommend it now for every single patient who graduates our program. So if you have questions about our maintenance program after you finish therapy, maybe you did this years ago with another doctor, or maybe you've done it more recently with another doctor and you're wondering, like, what could you continue to do? Feel free to reach out to us. You can connect with us if you're local by calling us at 618-288-1489. If you're not local though, go to our website at visionforlifeworks.com. You can either schedule a consultation to talk with me about what you might be able to do, or you can fill out a questionnaire, get some information and feedback, and the roundabout way after that is that we'll ask, do you want to schedule a consultation? Now, if you like this video, hit the like button. If you haven't done so already, make sure to subscribe to the channel. I have lots of great videos that we put out on a regular basis, and if you feel like this would be beneficial to someone, maybe you know someone who had VT in the past and they're not doing any maintenance. Maybe that's you, maybe it's a sibling, or even a child of yours. Obviously, feel free to pass it on to anyone that you feel could benefit from it. Thank you.